Here's a topic that every leader, manager, supervisor can use some help in, particularly during times of staffing shortages. Hey there, I'm Dr. Jim. My topic today, leading through staffing shortages. It's a reality that we have to accept and figure out very good ways of dealing with. So, two of the most dreaded words, particularly in senior care, but especially skilled nursing, are short-staffed. The American Healthcare Association found in a recent survey, this is whopping, this is terrible, that 94% of facilities reported staffing shortages. And out of those, 75% indicated that this trend has become far worse since 2020. While the pandemic, of course, is responsible for dramatic declines in healthcare personnel, many other factors continue to make staffing a challenge. This is why effective leadership is so critical in senior care, healthcare, and we could argue every industry out there, especially during times of low staffing. What we need to do in terms of leading through staffing shortages is to work on the root causes of staff shortage. Makes sense, doesn't it? In order to improve staffing, smart leaders will do their best to identify areas of weaknesses in their building, in their region, or possibly throughout your entire company. Because shortages will be greatest among nursing assistants and in the nursing department, it would be very wise to spend some time examining things like pay, benefits, advancement opportunities, workloads, and other variables that are directly or maybe indirectly associated with turnover. You won't know until you look. Asking very simple questions like, why do our staff stay? Or what are the causes that make them leave? Those are a good start. They're basic, they're simple, but they're a good start. Money matters, but respect and a positive work environment go a heck of a long way to keep good employees. Leadership is involved in a very sensitive balancing act between causes of turnover and damage control. What I'd like to talk about now is leading to prevent dangers of inadequate staffing. What am I talking about? A large part of leading through staff shortages is to prevent as many negative outcomes as possible, including the following: accidental or unintentional injuries or deaths, increased medication errors, increased falls, especially with injuries or fractures, increased hospitalizations or rehospitalizations. Those are dirty words. An uptick in emergency room visits, increased number of residents with bed sores or pressure injuries, all terrible outcomes related to inadequate staffing. This type of leadership might be viewed as a form of damage control because any negative outcome can harm the company's reputation as well as financial success. Leaders should take note of any risks throughout their facility to either minimize potentially negative outcomes or to try their best to eliminate them altogether. Now, how do we measure leadership success during times of staffing shortages? It's been said that we cannot measure. You're going to have to stop there. Let's see if we could. I hope you could slice this and dice this. Let me know if you can or cannot. Now, how can we measure leadership success? It's been said that what cannot be measured cannot be changed. Very true, right? This is particularly true concerning staffing shortages, causes of turnover, and preventing negative outcomes. Some measures will be quantitative, countable, and others will be anecdotal or qualitative. Either way, gaining ground on staff shortage will require measuring leadership success. And success can be measured in the following ways. Staff have the best possible and competitive living wage and benefits in their market. Quality of care has remained steadily high and has not suffered due to staff shortage. The culture of care is positive and healthy. Family, resident, employee satisfaction, they're all high despite your turnover rate. That's very interesting. And allow me to continue. Although staffing is a problem, your employees still feel respected and valued. Stress and burnout are acknowledged by leadership and management, your supervision, and they are addressed, not ignored. They're addressed in healthy ways. Here are my final thoughts on leading through staff shortages. Good leadership, even with low staffing, can shore up continued quality while preventing negative outcomes. Some important elements involve identifying weak spots throughout your care center and putting preventive methods in place. Creating a damage control mindset may help the entire staff navigate through times of low staffing. I'm Dr. Jim. I hoped this video, I also have the article online, is helpful for you, for your colleagues. Feel free to share it and keep coming back if you enjoyed this topic, because I have so many more. Well, I certainly hope you enjoyed the video, and thank you very much for your time. If you'd like more information about a great online learning management system with the most wonderful support, best in class support and partnering, please look for the link to the website in the description. You'll love what you see.